Our organization has grown from a small hospital serving the needs of a community to a large healthcare organization that now serves over 55,000 residents in 4-county area in northwestern Wyoming. We are much more than a hospital. We're a healthcare system that provides services to a growing population of both young and old.
I think we provide a lot of services that people don't always expect, actually. And I think for a small community that we have, we've had amazing growth. We've brought in a lot of services that I think you won't see in smaller communities elsewhere. We have a lot of specialists here as well that bring people in from the surrounding area. There are a lot of ideas, I think, about ways to reflect what the new growing needs are of the community and the growth that's occurred in Cody and in the Bighorn Basin.
So we formed a committee, and that committee involved community members as well as hospital administration personnel and personnel from our board.
I've seen it as this is my hospital. And when I was invited graciously to become a member of this branding committee, I began to realize what a far-reaching program this thing called the West Park Hospital has, and that name was just not going to make it in our modern society and was not representative of the diversity and the richness of the program and exploits of this institution.
It's very important strategically to really take time and assess, does our current organization's branding represent who we are as an organization?
I do think that the process was necessary. I think that you have to ask yourself, why are we doing this? What do we need going forward? And are we going to grow into the name that we have or the name that we need?
For me, I initially thought, well, why are we changing the name? What is this all about? And so I was more interested, as more of piqued my curiosity. So I was sort of involved in that. I wanted to see what the thoughts were behind this and kind of where we're growing as a medical community.
I believe it's important for our organization to have an overarching brand name because our organization has grown from a small hospital over 75 years ago that we're proud of. That's our heritage, having our first hospital in Cody to growing to an organization today that represents many different services versus just a hospital that, in my mind, denotes caring for the sick and injured.
I think we're more than just a hospital. We have services and that we provide to the community that range from home health, from home oxygen, to physician offices, to urgent care. So we're more than just a hospital. I think an overarching brand name is important for what we are trying to achieve.
Well, I recall things going in the direction of who are we to begin with, and what do we represent, and is the name West Park Hospital sufficient? I think those were two big things that I grasped. I began to understand the complexity of the organization as we worked through those meetings.
It was a very interesting process. I enjoyed it. We met several times, lots of discussion took place, but we did research and we did surveys and we really probed to try to find out what else other communities are doing, especially rural communities.
What we found as a committee is, when we looked at the data, is that hospital really pertained, people think of that as a place where you have surgery or where you go for an emergency, whereas the word health really encompasses behavioral health and encompasses healing and long-term care and all the other aspects of the services we provide.
The branding committee felt good about the name Cody Health because, number one, we're all proud of Cody. We're all proud of where we live. We're proud of our heritage. Cody is recognizable throughout the country, throughout the world. And with that, we feel proud to use the name Cody. That's where our hospital was first born. That's the nucleus of our organization that provides regional services throughout northwestern Wyoming.
So the name Cody Health is going to encompass all these other entities. The Bighorn Basin Cancer Center and the Cathcart Center, Spirit Mountain Hospice House, they're all going to be housed under Cody Health. We've grown and we need a bigger house.
And we needed something that was overarching for the whole institution, The two just work together. They're short, they're sweet, they're poignant, they're directive, they're concise, they're everything you want in a name as far as I'm concerned.
I think people wanted something that would seem identifiable, and I think Cody Health and Company is a lot of what we do with the various entities and growth in our community and in our services we provide.
It really fit in line with our vision, and our vision is to be the first choice for those who aspire to heal and be healed. It allows us to be recognizable to all the services we can provide, and to those employees, that work in the various departments, be proud of where you work. Cody Health is another, just again, our overarching name that we can really promote and really become the organization we want to become.
We are not changing our name. We're keeping our name West Park Hospital, which we're very proud of. We're keeping Spirit Mountain Hospice. We're keeping Cathcart Health Center. So we're coming up with a new name that represents our entire system. So the future of Cody Health is exciting, because Cody Health, when we acknowledge the great things that we're doing in all the different areas of our organization, not only acknowledges everybody within the organization, but it rewards them for the great things that we're all doing.